Welcome to Live with the Eczema Doc, brought to you by Clean Body, where we believe that you can heal your skin from within by cleaning your body. I'm Dr. Fong, a naturopathic doctor specializing in eczema, and I'm here to guide you through the journey of understanding the root causes of your eczema so that you can finally achieve the clear, healthy skin you deserve. Each week, we combine research-backed insights, science-based strategies, and my years of clinical experience to uncover what's really triggering your eczema and how you can take control for lasting relief. Let's dive into today's episode and uncover the next step to healing your skin from within. Hello, everyone. Today I am talking about navigating a healing crisis in eczema treatment. And what is a healing crisis? Well, it is just like it sounds. It is a crisis when you are going through a healing journey. And what this can look like, it can look like flu-like symptoms. It can look like detox reactions. It can look like increased symptoms. And it's something that's really hard to navigate because, first of all, you don't know if these are just adverse reactions to what you're doing or are these actually healing reactions. So today we're going to break this down. I'm going to help you to understand what these healing reactions are. How can you minimize these healing reactions? And then how can you, if you are experiencing them, what can you do to alleviate these healing crises? So today we are going to talk about what a healing crisis or a Herxheimer reaction is. How can you prevent and manage these reactions? And when should you seek help? If you're going through a journey on your own, when is it important to seek help? And I would say if you are thinking that you might be experiencing these Herxheimer or healing crises, I would recommend you are working with a knowledgeable practitioner who is then going to, hopefully work you through a couple of different phases so that you're not jumping to these healing crisis reactions, and we'll talk about why that does happen. So what is a Herxheimer reaction or a healing crisis? This is a temporary worsening of symptoms that occurs when the body is eliminating harmful substances because you are actually trying to treat the root causes. And what's happening is bacteria, yeast, toxins, parasites are dying off faster than we want them to, and this is a faster rate than your body can actually clear them. Okay, so that's typically when you'll get a Herxheimer reaction, or we can also call it a healing crisis or a healing reaction. This reaction is named after Dr. Karl Herxheimer. This was a German dermatologist who first described it in 1902, and Dr. Herxheimer noticed that patients with syphilis experience a sudden worsening of symptoms after being treated with antibiotics. So when we're being treated with antibiotics, at that time, we can see that we are killing off bacteria. And at that point, we might see these Herxheimer reactions or die-off symptoms are also what we call these. And this also happens when we are treating the root cause of eczema, which often lies in those microbial imbalances like bacteria, yeast, parasites, mold. When we're dealing with detoxing toxins out of the body, and we're just moving those toxins out of the body too quickly, and the body is just not ready for it. Okay, so that's why in my practice, it's really important that we take a stepwise pattern in terms of healing, and we're moving in phases, okay? So again, this is happening when we are killing off these bugs or detoxing these toxins too quickly. And we're often treating things like gut infections, again, those parasites, bacteria, yeast, fungus, mold that we're finding on testing. Maybe we're detoxing you of heavy metals, of environmental toxins like BPA, pesticides, mold toxins, which are called mycotoxins. And then as we're healing you, we are trying to activate your immune system often. But with eczema, sometimes that immune system is actually overly reactive already. And if we're trying to activate the immune system, sometimes we can have an increase in those eczema symptoms, okay? So the symptoms you might be looking out for, of course, increased eczema flares. So more redness, more itching, more swelling, more oozing can happen as you're having a healing crisis. And so that's why it can be really difficult because you're not sure, am I getting worse or am I actually healing? So we're going to talk about how you can understand whether these are actually healing crises or whether you're actually having an adverse reaction. Okay, so we'll talk about that in a second. You can also have flu-like symptoms. So you might feel like you're getting the flu, you're having fever, chills, body aches, but you're not actually getting the flu. So you're not actually having a full-blown flu, flu symptoms, like you're not actually getting sick, but you might be getting the fever, the chills, the body aches, which are indicating that your body is handling a microbe and trying to kill it off. Okay. So that could happen as we're really addressing these root cause issues. Fatigue or brain fog, headaches, digestive upset, mood changes, irritability, anxiety. You can have changes to sleep. Basically, a lot of different symptoms can happen. And often you're kind of feeling just a little bit like you're getting sick or like these symptoms are increasing. And how do we determine if it's a healing reaction or an adverse reaction? Well, typically a healing reaction is going to be a temporary worsening of your existing symptoms or those new symptoms that look like flu-like symptoms or just detox-like symptoms. And typically they only last between 3 and 7 days, and then you're noticing, maybe there's a peak and then it starts to come down. And that is indicative of a healing reaction. But if you're seeing new symptoms, very severe, and they're really lasting for a long time, they're progressively getting worse, it's not easing up, especially after a 3 to 7 day period of time, this might actually be an adverse reaction. If you're working with a team, at Clean Body, we have a team that supports you. And, I have myself and then a nutritionist supporting. So we can kind of be watching in on you. And my patients, we ask our patients to journal, give us journaling of your skin, your poops, your tongue, even your food. We just want to know everything. And we're actually watching this on a weekly basis. And our patients are able to reach out to us, on a daily basis, let us know, hey, I'm having a severe reaction. What can I do? And then we can review that and see what happened. Okay, did you eat something? Did you start a new supplement? Are you starting a new detox protocol? Are we addressing parasites right now? Are we addressing bacteria? Are we addressing fungus? Do we need to slow down? These are all questions that we can answer when we are able to really see what's happening and watch the progress. And so it can be helpful because when you're just assessing this on your own, it's just going to seem like the world is falling down at that moment. And you really, you don't know what's going on and you're thinking that everything's getting worse and you're going to freak out about it. And so having a team to really look in on what's going on is really helpful because that team is going to be unbiased. And then also that team is going to have a lot of experience with these types of reactions. Knowing that it's a Herx reaction or a healing crisis rather than an adverse reaction is really, really key because this is going to happen throughout a healing journey, unfortunately. And hopefully it doesn't. And hopefully we can mitigate these reactions. And we'll talk about how we can do that in a second. A healing reaction might be more detox or flu-like symptoms. And then adverse reactions might look more like severe allergic reactions or side effects where you're going to feel like you really need to go to the doctor or the emergency room and you should, in case you're having an adverse reaction, okay? And it's really important that you aren't necessarily deciding this on your own. I think again, having a healthcare practitioner who really understands this is very important because, maybe you are having an adverse reaction and you're thinking it's just a healing crisis or a healing reaction. So we do need to make sure that what you're going through is a healing reaction or healing crisis instead of an adverse reaction, because that could, be very important to distinguish. So how can you prevent these Herxheimer reactions or healing crises from happening? Well, I find that, the problem that occurs when people end up coming to me and they're like, well, Dr. Fong, I uncovered that I have mold and I have a parasite and I went on a parasite cleanse and I did a mold cleanse and I just had such severe symptoms and I just can't get through it. And I'm so sensitive and I just can't take it. And so I'm never going to heal because I can't do it. And, what I'll say to that is you are detoxing or cleansing before your body is actually ready. So remember what a Herxheimer or healing crisis reaction is when you are cleansing the body too quickly and faster than the body can actually clear out the toxins. Okay. So you're either taking too much or your drainage organs, I call these your drainage organs, are not open. They're not ready to release these toxins. And your drainage organs include your gut, your kidney, your liver, your lymphatic system. These are all parts of your drainage system, which is what exits toxins, right? So you exit toxins via your poop, your urine, your sweat, your breath. These are all ways that toxins exit out of your system. If you're constipated, for example, you better not be trying to kill any microbes or anything, because they have no way of getting out of your system. And the only way they're going to be able to get out is your skin, and you're going to have increased eczema symptoms. Okay. So the biggest problem I often find is that you are cleansing faster than you should, or before you should be cleansing. So I like to do things in phases. So phase one is always, let's figure out your core deficiencies. For an eczema person, that is often things like vitamin D, omega 3s, vitamin C, these key nutrients that we find in eczema patients that are often low. And often just all of the vitamins and minerals and nutrients are low in an eczema patient. Maybe they're not consuming those nutrients, or maybe they're just not absorbing them. So we need to make sure that we give you those core nutrients. Then we need to support what I like to call your core organs. So we need to make sure that if you're having any sleep issues or hormonal dysfunction or immune system activation, we need to lower that immune system activation. We need to support the hormones. We need to support what I like to call those core organs before we ever start to detox you, okay? Because if we try to detox you and cleanse you, and these organs aren't even strong enough for you to do that, you are not going to be a happy camper. Okay. Drainage organs is the next phase. So after the core is really supported, we will already start to see that the skin and the symptoms are getting a little bit better. Then we know, okay, things are opening up and things are being supported. And now we're ready to move on to phase two. Phase two is where we support those drainage organs. So your gut, your kidney, your liver, your lymph, your bile production, all of this is really important. And so we just help those organs to do that job. So we're not yet, are we killing off bugs? Are we cleansing out toxins? However, in the process of supporting the drainage organs and the core organs, sometimes some of this does occur. So this doesn't mean that we avoid Herx reactions, completely, but we can by going in this slow phase-wise manner. Okay. So then after that drainage piece is ready and we have everything is open, you're pooping every day, you're urinating well, you're drinking a lot of water, the symptoms have already started to get even better. Now we start to do the cleansing piece. And this is where we might use antimicrobials to kill off any bugs that we find in your system, like bacteria, yeast, fungus, mold, parasites, etc. We might cleanse toxins that we find, like heavy metals, mycotoxins, etc. And in that process, we hope that we are cleansing at a rate that your body can actually handle the excretion of these toxins so that you do not get Herxheimer reactions or healing crises. Okay. And by doing this stepwise approach, we hope that we aren't going to have a lot of these. And so that doesn't mean we're going to have zero, but hopefully we're going to minimize these. Okay. And then phase four is, once you're clean, and what I like to call, you've achieved a clean body, you have no more symptoms, you're doing great. It's not now that you just go back to where you started. We also have a phase four, which is, okay, now let's maintain this clean body for life, which is, okay, what do I need to maintain? All right, I need to make sure I'm always eating omega 3s, or I take an omega 3 supplement. I need to make sure I'm getting out in the sun or always taking vitamin D. Okay, so it's not just about getting there, but it's also about staying there. Being healthy and having a clean body is a lifelong process that we need to keep working on. But at that point, it doesn't feel like work. Okay. So that would be the hope. All right. So what happens if you do end up having a Herxheimer reaction or a healing crisis? Well, hydration is key. You need to be drinking a lot of water, because that is, again, one of our exits. That's how we flush toxins out of our body, is via our urine. So you have to drink a lot of water if you're having a Herxheimer reaction. Supporting your detox pathways. So when we're working with patients and they end up letting us know, hey, I think I'm having a healing crisis, they're going to do all the things like hydration and actually eating their good food, eating raw vegetables, etc., making sure they're doing a lot of fiber so that they're pooping really well. Next, we might recommend some support for the liver, the gut, the kidneys, and even binders to help bind up the toxins, so that if the the toxins aren't getting bound and out the body, one, you might not be pooping well. So we got to make sure you're pooping well. But two, maybe we can use binders to help bind up the toxins in the gut so that they don't recirculate back into the system and cause more problems and cause more symptoms. Okay. Having a Herx like reaction or a healing crisis is almost like having a hangover. If you've ever had a hangover and you've drank too much alcohol, and that's exactly what's happening. Your body's overwhelmed with toxins and you're not able to exit them. So they're just recirculating through the system. It's giving you a headache and you're sensitive to sound and all of that. So it's really similar to a Herxheimer reaction or a healing crisis. If you are on a protocol that stimulated this healing crisis, we need you to slow down. So we typically will ask you to either stop what you're doing in terms of the specific supplements that are causing the antimicrobial effect or the detox effect. Will keep you on the core supplements, but we'll take you off things that are like the cleansing supplements, or we might just lower the dosage, or we might stop it for a couple of days and just bring it back. Or we might just cycle through them, right? We might go on, off, on, off, on, off, and that would be a better approach so that your body actually has time to heal, or so that we're not overwhelming your detox pathways with these toxins. We need you to rest and really listen to your body. If you're sleepy, sleep, and I know that sometimes we can't always do that. But when you are going through a cleansing protocol, it can be really important to do this. So I often like to reserve my cleansing protocols for when someone actually has the time, the space, the energy for this. And until we do that cleanse protocol, we can still do the core and the drainage phase, which is going to do a lot to support the body. And we might just need to wait for that cleansing piece at the end, okay? And when you're ready. We can soothe your skin with topicals like our Clean Skin Topical Kit. I also love the Soakness Bath, which we sell on our website as well too. So you can go to cleanbody.health to check out some of these supplements. And, just things to help soothe. I love the healing baths, the Soakness baths. This is something I did when I had TSW and when I was going through my healing crises. It really saved me to be in those baths, and it just felt really good on my skin, and I would come out and feel better. So, that's important. And as we talked about, tracking your symptoms is really important. So at Clean Body, again, we give our patients a journaling system. It's an app on their phone, and that really allows you to kind of see, okay, why did I get this healing reaction? Was it a supplement? Was it something I ate? Was it I was stressed out? So all of these are important. And if you aren't working with us, then, journal yourself, either use an app, there are symptom tracking apps out there, or get a journal, just a pen and a paper, and just write things down so that you can understand what might have caused your Herx reactions. Okay. I do recommend, if you have a healing crisis or a Herx reaction and you're not working with a practitioner, I highly recommend you work with a practitioner. For example, me and my team, this is something we're so familiar with. So we don't get worried when it happens, and we're able to kind of give you that reassurance that, okay, this looks like a healing reaction. Let's slow this, and this down, and you're going to be fine in a couple days, and we can give you that reassurance, which is really great, because otherwise you're just going through it. You're having all these adverse reactions and you really just don't know. And you might actually be having adverse reactions. You might be taking something you're not supposed to. Another thing that I do see is that people are taking antimicrobials and they shouldn't be taking them. So they might have heard somewhere, oh, taking an anti-parasite medication or supplement helped all these people with eczema. And yeah, that could help some people, but you might actually not have a parasite. So it might not be something you need to be taking. And you could be taking it and it's actually destroying your microbiome. And you think it's helping, but it's actually not doing a good job for your microbiome. Okay. So these are reasons it's so important to work with a practitioner who really understands this, who focuses on eczema and skin. Can be important too, because with eczema and skin issues, there can be more reactions that are just more apparent because the symptoms are right on our skin. Okay. So it can be really important. All right. Well, I hope that this helps you to navigate Herxheimer reactions, healing crises. I know this is something that happens to almost everyone if you are trying to take a root cause approach. Of course, if you're taking a conventional medicine approach, that's a little bit different. With conventional medicine, you're just silencing the symptoms. You're not actually trying to go deeper and kind of bring things out. When we go deeper and we get to the root cause, we can be digging up old stuff, and we could dig up, microbes that are just hidden in the system, toxins that are hidden in your fat and your tissues. And all of a sudden, the body gets what it needs and it starts detoxing. And if those drainage pathways aren't open, they can get overwhelmed and then you can get all these symptoms. Okay, so I know that this happens. And a lot of people have reached out to me. They're like, what is going on? I don't know what's happening. Have you seen this before? Have you dealt with this? And I will tell you, this happens to almost everyone who is on a healing journey and they are treating the root cause. So it's something you really need to understand. Work with a team that will help you to understand and navigate this, and you will get through it. And oftentimes, these Herxheimer reactions or healing crises are signs that you are healing. So, in the grand scheme of things, it's actually a beautiful thing happening. Your body's cleaning out, it's clearing everything out. But I know in the moment, it does not feel great. So, hopefully, this helps, and hopefully, this will help you navigate those healing crises. Thank you for joining live with the Eczema Doc. I hope today's episode provided you with valuable insights and tools to support your journey to healing your skin from within. For more information, visit www.cleanbody.health or check the links in the podcast description. You'll find the studies and resources discussed today on my blog. You can also take my free eczema root cause assessment to uncover potential triggers or download my free eczema relief guide for quick, practical tips to calm flare-ups and help with your sleep. If you found this episode helpful, please remember to like, subscribe, and share the podcast to help others on their healing journey. And if you'd like to stay updated with future episodes, please turn on your notifications so you don't miss a thing. Please remember this podcast is for informational purposes only and does not constitute medical advice. Always consult with your healthcare provider or book a consultation with me before making any changes to your healthcare regimen. When you clean your body, you heal your skin from within. Thank you again for listening, and I'll see you next week.